Hello, my name is Jon Dickinson. I am delighted to share this case study as part of my application for the Communications Officer role at Leeds City Council. And today I want to walk you through a successful campaign that I managed from start to finish, which is the Community X-ray Service campaign. The goal was to explain a complex new healthcare service in a way that was easy to understand, warm, and highly accurate. Working in the public sector means telling stories that matter to real people whilst making sure we are efficient, making sure we're ethical, and making sure that we're careful with public money. So, without further ado, let's look at what we set out to do. So, Community X-ray Service brings hospital standard X-rays directly into care homes. This means that vulnerable residents don't have to travel to hospital for an X-ray, and this in turn reduces stress for them and stress for their families. Our main goal was simple, and that was to raise awareness and get the public and health professionals to use this new pilot service. So, to do this, I built the campaign around three core pillars. So, first of all, promoting patient dignity by showing care delivered in a comfortable, familiar place. Second, showing the practical benefits, specifically reducing unnecessary hospital travel and taking pressure off the ambulance service. And third, highlighting the Trust's core values of ambitious, caring, and together. These pillars kept all of our content focused on the same clear goal. So we knew that a single generic message wouldn't work for everyone. So to get the best results, I split our target audience into three clear groups. So first of all, public and families. They wanted to be reassured that their loved ones would be treated with kindness. And because this group connects better with personal, emotional stories, we reached out to them mainly on Facebook and Instagram. Second, our professional stakeholders. These would include people like care home managers and nurses. They need practical facts. How does the service work? How do we book it? So we targeted them on LinkedIn with clear benefit driven posts. And finally, came our internal trust staff. So building pride and awareness inside our organization is key to any new launch. So we used internal newsletters and our staff intranet to celebrate the new service. To keep the multi-channel campaign organized, I designed and ran a hub and spoke digital model. So in the center is an easy to read detailed article which was hosted on the Trust's public website. So inside this article, we embedded our high quality YouTube video. Surrounding this hub were our spokes. This were Facebook, LinkedIn, Instagram, and again, those internal channels. So instead of just posting the same thing everywhere, we tailored each social post to its specific audience, and every single post pointed back to the main website hub. This made it easy for interested users to find full verified details in one place, and it allowed us to track our metrics accurately. Our content strategy was built on keeping a consistent voice across all of our channels, and you can see examples of this on your screen right now. So we did this by following four simple rules. First, we wrote in plain English, removing medical jargon so the service was immediately easy to understand. Second, we kept our writing professional yet warm, making it sounded more safe, more trusted, and most importantly, human. Third, we used a human-centered visual style, choosing real photos of our staff and patients instead of cold stock images. And fourth, we connected our messages to the Trust values to build a sense of pride amongst our staff. So by keeping the look and feel the same across our website, our graphic, our video, we were easy and we were quick to build the trust with audiences. So as we know, in public sector communications, accessibility is not just nice to have, it's a legal and ethical duty. And I planned this campaign to be accessible by design. So I built and structured the website page to meet the WCAG 2.1 AA standards. This means that it works perfectly with assisted technology like screen readers. I also manually wrote and synchronized high contrast subtitles for every single video that you can see. This was essential for viewers who are hard of hearing, but it also helped our social media reach since the majority of people watch mobile videos with the sound turned off. So we made sure that no one in the community was left out. Now, taking photos and videos in a care home requires great sense of care and respect, as you can understand. So as you can see in the photo here, we were working right at the patient's bedside. So before any equipment came into the room, I put together a strict ethical and safety checklist. So we had to put this to test immediately, and our first scheduled patient was assessed and found to lack the mental capacity to sign our consent form. So instead of rushing off or taking ethical shortcuts, I worked closely with our care home managers to find another resident who was fully able to consent. So I took the time to explain the rights, including their right to stop the shoot at any time before they signed our standard release form. And doing this protected not just the patient's dignity, but also met infection control rules and kept our reputation and the trust reputation safe. On reflection, I'm incredibly proud of how efficient this campaign was. Local government teams must deliver high quality professional work while protecting public funds. And by delivering the entire campaign, um, the external agency spend was exactly nothing, £0. I acted as a self-sufficient one-person creative team. I wrote all of the copy, I took the photos, filmed and edited the video, designed the social media graphics, and scheduled the post. We proved that with smart planning and creativity, you can get professional results on an organic public sector budget. Now, as any great digital communicator knows, you can't just launch a campaign and walk away. What we need to do is watch the data closely and adapt in real time when things go wrong. So overall, our campaign numbers were fantastic. On Facebook, we got over 27,000 views. On LinkedIn, we achieved an exceptional engagement rate, which is 3 times more than what the trust usually achieves. However, we hit an unexpected problem on launch day. A sudden technical glitch with our scheduling tool, Metrical, blocked our video from posting to Instagrams. So to stay on schedule, I used our plan B and manually uploaded a close-up photo of our camera equipment instead. This kept us on track, but the post got no engagement. So I realized our Instagram audience wanted to see more human connection, not cold machine. So 2 days later, I pivoted and posted a warm photo of our team smiling. This quick change worked immediately, taking our engagement from 0 to 11 interactions. And even though Instagram is not necessarily our strongest platform, it proved that public audiences connect with people, not just technology. Our video data also backed this up, showing a strong 33% completion rate and an average view duration of 1 minute and 23 seconds. This proved that our storytelling successfully kept the public's interest. So in short, this campaign shows an ability to combine smart digital strategy with strict ethical standards, real-time problem solving, and data analysis. I am extremely excited to bring these exact skills to the communication team at Leeds City Council. I'm fully ready for your hybrid model. I look forward to working closely with colleagues in the Leeds office on collaborative days while still delivering high-impact, self-sufficient campaigns from home. Thank you so much for your time today. My email's on screen, and I look forward to hearing from you in regards to the next stage of the application.